a little trick. I don't use EMLA cream. Sometimes I use an ice pack just to numb the area just before injecting, because this is the only moment, c'est là où ça va être un peu douloureux, where it's a little bit painful. Maybe you can show the profile. Show the profile, ça va? Voilà. So I'm there. Vous pouvez fermer les yeux si vous voulez. Hein? So I'm injecting very slow. You see my hand and the piston with this wonderful B-soft syringe. It's great. Okay. Voilà. So I'm going very slow, and the lidocaine step by step is numbing the area. Okay, you can also use your 2 fingers. Camera 5. Voilà. Camera 5. Camera 5. Thank you. Okay. Now I'm going a little bit lower on the nasal spine. You see, it's a bit painful. Ça va? Petit à petit, ça va s'endormir. Hein? So also reassuring the patient, injecting very slow. It's a good idea. Voilà. Just relax. Because if you use EMLA cream, then you numb the skin not lower than the skin, so it's not appropriate. Voilà. So now I've got a bit of projection. I'm going a little bit more superficial with the retrograde injection on that nasolabial angle. And you can see, can you zoom on camera 6 on the profile? Voila, you see the tip elevation, slowly the tip elevation. So now I already injected 0.4 ml. Voila. So now we stop. We look at the sequence. So the nasolabial angle is a little bit higher. The tip is a little bit higher. I use... où est-ce qu'elle est la cupule de la seringue? De l'aiguille? La cupule. Vous avez vu la cupule ou pas? Je ne l'ai pas posée là. Ah bon. On va prendre celle-là. So now, ça va? Ok. Petit coton-tige là. I use a little trick not to be in contact with the lips. We're going to bend on a sterile way the needle into the cup. The cup is sterile. So we bend the needle exactly at the angle that we want to achieve. So this is sterile. And I'm going to use the same entry point. And normally it's less painful than before. Okay. So now that I am doing the injection, you see the lifting of the tip. You see how high is the tip now? Okay. And ça va? C'est un peu douloureux encore? So it's painful, still a bit painful. Right. So we are using 0.7 ml on the tip. Voilà. So to show you where I am, I'm not superficial, I'm really deep into the columelle. Okay, and at this junction, now you can zoom in. I do a bolus right here. You can also pinch a little bit the skin. C'est bon, si ça saigne plus, vous pouvez enlever. Voilà, and camera 6. Voilà. So you see, I'm doing a bolus and then I move from this bolus medially, voilà, right? And you see the gel. Zoom out. C'est pas bon l'image là, on voit pas le nez, regardez. Okay. Perfect. Now, so we try to make this look straight. Voilà. And the secret is really to go very slow. You see it's still a bit painful. She's young, she has a very elastic tissue. Everything, all the soft tissue are stick to the bone. Okay. So I have to work slowly. And I tell you, in this case, if you use a cannula, it will be painful like hell because you have to detach all the soft tissue. Can we have camera 5, please? Okay, so I can show on camera 5 that I get these two parallel aesthetic lines. Okay. And now we have already 1 cc. So normally I try to use only 1 cc per session per nose. Camera 6, okay, right? So we can use a little bit more of product on the dorsum. The thing is, if I use more, I will have a nose which looks bigger, okay? So in my office, I will stop there. I will say to the patient, now we are at the maximum that I can do with one session, okay? Okay. Voilà, you see the opening of the nasolabial angle. On the front view, camera 5, please. Voilà, we have aesthetic lines. The nose is not that wide. Now I'm doing a bit of molding with my fingers. So the fingers has to be like a V shape, like this. And I mold the product to get this product really medial and not to over-inject laterally and have a swelling, because then it's difficult to correct.